in a very interesting disease called fibromyalgia. The cause of pain in fibromyalgia patients is fibrosis. Why is it that fibromyalgia patients can be given all the pain meds on the planet and it doesn't alleviate their pain? Why is it that fibromyalgia patients can be given all the psychotropics on the planet? You can Prozac a fibromyalgia patient until they don't know where they are or who they are, and it won't change their pain one whit. And for this, we have to touch just a second on cardiology. When a patient has a heart attack, the doc knows that heart's going to hurt for 3 solid days. And yet the doc knows he's not going to give him any pain meds because they won't work. Why? The pain is the pain of something called ischemia. You've all done it to yourself. You've all experienced ischemia. When you were kids and you put rubber bands around your wrist and you saw how, wow, it's purple, that's really neat. And then after it turned purple, it began to throb. And the more you tried to move it, the more the sucker throbbed. And the more it hurt. You could have mainlined heroin right then and there, and that hand was still going to hurt. What took away the pain? When you took away the strings of the rubber band and you restored the circulation, the oxygen supply to the tissue caused it to stop hurting. In fibromyalgia, we have a complex mechanism, a multidimensional mechanism, where stress and estrogen dominance and fibrosis production from the estrogen dominance produces a lot of this scar tissue in muscle tissue. And it's just like putting the rubber bands around your wrist. All of a sudden, you've got these knots of fibrosis, fibromyalgia. Everyone thinks about the symptoms of fibromyalgia, but no one gets to the root cause, the fibro in fibromyalgia. You have all this interlacing of the fibrin in the muscle tissue, cutting off full circulation, plugging up the little microcirculation that feeds that. All of a sudden, you've got pain. And the pain meds won't deal with it. The psychotropics aren't going to deal with it. The pain's not going to go away until you put in the enzymes to eat away at the fibrosis. There are very few, hardly any, fibromyalgia patients below the age of 27. There are very few, if any. And those patients who are younger than 27 who do have fibromyalgia, you can show that they have enzyme deficiencies.